Hi, this is Dr. Jim Anderson from Anderson Podiatry Center for Nerve Pain, and I'm here to talk to you about Restless Leg Syndrome. This is sort of a passion of mine because we've really been able to help people a lot over the past 6 or so years. We're finding that we're able to have a very high impact on helping these people because it's a very frustrating problem. It's been estimated approximately 10% of the American population suffer from restless legs, and probably 5% it's very severe. And the symptoms are going to be simply a creepy crawly sensation in your legs. Maybe your legs will jerk at night. Maybe you'll get a pulling or a tightness or a cramping in your legs. It usually comes on at night, and it's very seldom noted during the day. It's oftentimes noted when you're sitting or lying down or maybe on an airplane ride. And that's really awkward because it's hard to sit still on the plane. So it's also something that affects other people, because if you have a bedmate, you're probably kicking them. I've had one patient, in fact, that no longer rips up the sheets at night. He actually told me that because he was that violent at night. And some of you, and I've heard your stories, you're sleeping in another room. Somebody's on the couch or somebody's in the other bedroom. So wouldn't it be nice to be back together? So this is sort of a silent problem too. And the frustration with it, it's really a sleep issue. You can't sleep, you have insomnia pretty much, and that affects your health in a lot of ways. And you probably have read, sleep is really important. If you don't get adequate sleep, you can gain weight, causes diabetes, it can cause a lot of other health issues by not sleeping. So that's how I look at this. I feel like we can benefit you a great deal. So what are the treatment, or what are the causes, I should say? Causes are not really known. We know that it may be secondary to genetics. Probably about 50% of restless leg patients have somebody else in their family that also has restless legs. We also know that it may have something to do with your DNA, and maybe there's genetic studies that have been done, and also your iron levels, that's another consideration, and some would even say it's a central nervous system. It has something to do with the chemicals in your brain. I don't want to get into a long discussion about those other things. What we believe here at Anderson Podiatry Center for Nerve Pain is that a lot of this is a problem, guess what, in your legs. It's actually a leg issue, and it's mainly a problem with one or two nerve tunnels. And so what we've found that we're able to do now is we surgically can open up one or two of these tunnels. These procedures allow you to walk the next day, take about 40 minutes, and it's on an outpatient basis. And many of our patients have immediate relief within the first few days. They're much better. They're off the medication, and if they're not off the medication, they can at least lower their dose. And we're very excited about this. In fact, we have 2 studies. One of these studies is going to be sent out for publication as we're speaking right now, and another study, we're putting people into this study as we're speaking. So to establish statistically, and we've had our study, which is an IRB approved study through University of Colorado Healthcare System. They have actually used statistical analysis to show how valid this is. So it's very exciting. I'm very optimistic for you. And I really want you to reconsider, if you're out there and you're just not sure and you're hopeless and you want to get some sleep, at least consider our option and give us a call or visit our website at andersonpodiatrycenter.com. Thank you.